Greetings, everyone. Welcome to another episode of The Professionals You Should Know. This show's about uncovering the journeys of professionals from different industries. And today, we have the delightful and empowering Gillian Sewell, who's a speech and language therapist. Thank you for joining us. It's a pleasure to have you here.
Thanks for having me.
So, what is it that you do?
So I am a speech and language therapist.
So what's that?
So basically, I support people with communication difficulties and also swallowing difficulties. So it's kind of a bit of both. Lots of people don't know that is our job role, and get confused with the title. So they think that we deal with elocution or someone's accent, but it isn't. It's not that. So in terms of the job role, I will assess for difficulties with expressive language. So any difficulties where somebody is struggling to speak and express themselves, or difficulties with understanding. So that's receptive understanding. So anything that they are being told verbally, or maybe something in their environment that is visual that they don't understand, I'll assess for difficulties in those areas. In terms of the swallowing, so the swallowing, any swallowing issues we call dysphagia, and those are assessed usually with people who have had some sort of head trauma or stroke. Sometimes in hospitals. I've worked with people with learning disabilities as well who have had swallowing difficulties, and it's all to do with the brain and the damage to the brain and how that affects the swallow itself. So we do assessments around the swallow function to see where the damage is in the brain and how that.
How would you do that?
So, so we would typically do what we call a manual assessment at bedside. So, for example, if somebody has had a stroke and they're in hospital, we would do like a visual assessment of them having something to drink or something to eat. Like water is probably the easiest thing for people. And if it does go down the wrong way, or they cough it up, there's no real danger to the person. So you observe how they drink, and if they are able to keep the liquid in the mouth, if there's any dribbling, any sort of unevenness to the face, if there's any coughing or choking once they've had the drink, or if there's any after effects. So, for example, if they've had a drink and then later on they may have some difficulties with their chest, for example, a chest infection, then we know that there are issues with their swallow at that point. So there's lots of things within that assessment that we look at just on an external level to assess where the difficulties are. A lot of the time with someone who's had a stroke or a head injury, we will get information about where the damage to the brain is, because the swallow is governed by the brain and the what happens in the brain. So it's wherever the damage is to the brain is where you'll find the swallow dysfunction is. So it could be that the damage just affects the mouth, or it could be the throat, or it could be lower down. So we look at the whole swallow, kind of the journey of the food or drink from the mouth to the stomach, and all the way down, and what happens from here to here, basically.
And for
That's
speech,
how we assess.
Is that the same thing for speech as well? So, if they're having difficulties getting out words, then you will be able to kind of facilitate them to understand what's going on? Is that how it works?
Yes, so with speech, it's more that you are assessing for the different areas of delay. So with some people with speech difficulties, it kind of depends on what's going on for them. So you can have people with maybe a diagnosis of learning disability, or you know, they might have a ADHD, or they might have autism. There could be various reasons why someone would have difficulties with their speech. The assessment would look at where the deficits are for them. Again, you know, mostly centered around what's happening in the brain. You know, children with speech delay, for example, that, you know, that kind of thing. So the assessment will be mainly around, yeah, as I said, where the deficits are. And then we can, once I've assessed where the deficits are, then I can say, okay, well, these are the areas that we need to work on. Right. This is what we need to be doing for this person. Okay. And it's the same with the understanding as well, the receptive skills.
How they interpret, is it how they interpret it?
How they interpret information, right. Yeah, how they grasp information, how they process. So all of that comes into it. And we have a lot of assessments and things that we do, yeah, and it just depends on how the person presents as to what assessment we do for them to see what the issues are.
So why speech and language? Like, what was your journey? Like, how did you become a speech and language therapist?
I've got 3 children, two sons and a daughter. They're all grown up now in their 20s. Okay. But thank you. It's good cream. My middle son, Cameron, he had hearing difficulties as a child. Okay. And when he had his developmental checks, you know, the health visitor will visit you every few months after you've had a baby and do the standard weight checks and hearing checks and that sort of thing. So they found at about 18 months that he wasn't really hearing very well, and decided to investigate further and sent him to audiology to get hearing tests and various things. So whilst we were going backwards and forwards to the audiologist, there was a speech therapist there at one point. Now Cameron, he wasn't able to, virtually he was deaf virtually. What they discovered was that he had something called glue ear. Okay. I don't know if you've heard of glue ear. No. I'm going to teach you lots today, right? So basically the tube behind your ear, called the eustachian tube, it's as a child it starts off very, very short. And then as you grow, it extends. So all of it's essentially there to drain off any fluids, lymphatic fluids. Right. And in children, because it's so short, it doesn't always drain away the fluid. So the fluid will get stuck behind the ear and then stop the eardrum from moving. And then, you know, they then can't take in any sounds. The eardrum often gets stuck to the tube as well, so it doesn't even move. So you have a lot of children that present with a kind of a deafness, and that's what happened with my son. Okay. So if his back was turned to you, he couldn't hear. Right. So we used to have to turn him to us and speak to him, and then he learnt to lip read, and then that's how he developed his speech. So we'd go to audiology. He ended up having grommets, which are like little tubes that they put inside, that insert through the eardrum to drain the fluid away, which did help and, you know, improved his hearing. But as we were going to the audiology visits, you know, we'd do this sort of every 6 months or so. I met a speech therapist there, and she was just sort of sitting in the corner. She didn't really have much to do with Cameron because, you know, he could speak. Right. So her job wasn't really to support his speech because he had it. So she was just there to observe to see if there was anything really that she could do. So I asked her, you know, what is it you do? So I was thinking, well, she's just watching. So I said, what is it you do? And she said, well, I'm a speech and language therapist, and then explained her job to me. And she must have not been very busy this day, because we sat for about 40 minutes while she told me about her journey. And I said, I'm really interested in what you're doing. Obviously, you know, you see clients much more complex than Cameron. So I'd like to know more about it. So she told me how to apply to uni, where she went, and the sort of the path I should take. And I thought, oh, okay. So I went off and applied to uni, and that was it. Wow. And here I am.
Did you specialize in anything in particular? Like, I know, did you specialize in anything in particular?
So when we were doing our training, they send you on placements, as you know, they send you on placements to various different places. And what I found out since leaving, you know, it was a long time ago, I qualified, but I found out that they earmark people for certain cohorts of clients. So when they see you working with people, the tutors will kind of send you on the placement they think will be suited for you. Right. So my placements, I did a mixture of things, you know, acute, pediatric, and you know, mainstream, adults and adults with learning disability. But the one that I liked the most was adults with learning disability. So I decided when I qualified, rather than sort of follow the herd and go off into pediatrics and working in mainstream schools, which I didn't like very much, I thought, no, I'm going to go into adults with learning disabilities. So that was initially my specialism. Okay.
So what was like a client like that? Well, how would the client present to you, like with a adult with learning difficulties? What would you be doing with them? Like,
well, so I mean, we also, as speech therapists, we do, I mean, obviously we assess for difficulties with communication, you know, speech, expressive and receptive, and swallowing, as I've mentioned. But we also look at supporting social understanding as well. Social skills, you know, how to be appropriate around other people, how to make friends, how to start conversations, how to end conversations appropriately, as well as looking at kind of difficulties with feelings as well, and what that looks like, and how to support someone to express themselves when they're feeling anxious or scared or worried. And a lot of that is to do with how, you know, again, it's the understanding of the environment, and for some people not being prepared for what's coming, so they then become anxious, and maybe you'll see behaviours as a result. So it's putting things in place for people so that they can be prepared, and then you don't get the aggressive behaviours. So we do make all sorts of resources like social skills. We work with people with comic strip conversations, which are essentially when you're drawing a situation that is going to happen or has happened. So you put yourself or the person that you're working with into the drawing. And then you, for example, if yourself and your brother had an argument 5 minutes ago, and you're really angry, and you come to me and say, oh, he stole my car, whatever it might be. So I'd sit you down and I'd say, okay, let's talk it through what happened. So I'd draw you, and I'd encourage you to take a pen, and you could draw as well. And then we would do, you know, we'd annotate the drawing. So we'd say, what did you say? What did he say in response? How do you think he felt? How did you feel? So then we get all the feelings and what was said out there and all written down. And then we work through what happened just to see what we could do for next time and how to reflect on that.
Oh, that's interesting. I didn't know that.
Yeah, there's a lot to our job as speech therapists, and I think we we do a hell of a lot more than people realise, because we also overlap, I think, with some other professions as well.
Right,
we work, you know, quite closely with others. So, yeah, there's a lot that we do.
So you were saying you was doing the adult and
yes,
yeah, and then you was going on to
yeah. So that initially I said, right, I'm going to work with adults.
Right.
That's going to be my thing, and that's where I stayed, and I specialised in adults with learning disability. And then I looked more into the autism, because I was always really interested from my placements in people that had autism. So that was all I did, just working with adults with autism and learning disability, and also ADHD. And then I worked for quite a number of years with adults, and then decided to work with children with the same needs, which I found, you know, there's a real, I think with working with adults, there's a real, I guess, I felt very frustrated in working with them, only because I felt that there wasn't much money or support put into the you know, the services that were out there for them. So they could only get so far, and then that was it. There wasn't much else available to them. And I felt always like I had to fight their corner, because they weren't getting what they deserved. The reason I moved on to working with children was because I thought, well, if I can start earlier, then I hopefully can make a difference earlier. And I, you know, and then there'll be more of an improvement by the time they do get to adulthood, and hopefully that will make some difference. Yeah.
That's incredible. And if you had to say, who do you feel that appreciates your service the most? Could it be patients, you know, or individuals, or, you know, the government, society? Like who
Definitely not the government.
Okay.
I would say probably the patients, even without realising that they do. The rapport that you build with people, you know, over the years, the rapport I've built, the relationships I've built with adults and their families, and you know, the children I've worked with and their families as well. I think they appreciate the work, even if they can't see huge difference in the person. They appreciate the fact that you are investing time in them. You know, I think it's, over the years there've been lots of really good moments, you know, in terms of the support I've given, and it's a shame that the government, I think, don't recognise us as much as they should.
So which one of the, like, if you was to name one, like, what's one of those kind of a standout moments that just reinforce that, you know, yeah, this is what I love doing and this is where I see myself?
There's quite a few.
Yeah, this one.
Yeah, we don't have time. So when I was working with adults, I worked with an older man in his, I think he was in his 60s at the time. Non-verbal, he had a diagnosis of autism and learning disability, and he lived in a residential home. He was very much contained, you know, staff looked after him and fed him and washed him, made sure he had clean clothes and, you know, met every need in that sense. But nothing else. So there wasn't very much communication with him unless he wanted something to eat. And then they'd say, oh, you know, do you want some lunch or do you want some breakfast or whatever. That was really the only dialogue they had around meal times or around personal care. So I embarked on a course at the time. It was an intensive interaction course. And that focused on supporting people with their communication and the fundamentals of communication. So helping people like him who were non-verbal, and he was very much in his own world.
Right.
So he spent most of his day doing this.
Wow, okay.
And you'd come in and just see him sitting in the corner, and the other residents were kind of doing things and staff were off doing, and he was just like this. Until he wanted a meal, Then he'd get up and walk to the kitchen door and look in and do that at the door. And then they'd say, oh, do you want to? And then they'd engage with him. So I embarked on this course, intensive interaction course, and it was really largely for people that are locked in almost in their own world, like this man. You know, but it was used to try and support people to kind of step out of that and see the value of communication with other people, and so that they'd want to do it themselves. So I worked with him whilst I was training to be a coordinator, intensive interaction coordinator. I worked with him for about 1.5 years. So I'd come in more or less every other day, and just work with him. And you know, it was all about letting him lead the interaction. Yeah. So whatever he did, I'd do as well. So if he decided to lay on the floor, then I'd also lay on the floor. Okay. And just get a little eye contact, even if it was fleeting, or you know, just get something from him which would lead on to something else. The staff would kind of look at me like I was crazy. Who's this woman? And so I explained to the staff, and when they asked me, what are you doing with him? I explained to them, this is what I'm doing. I'm trying to support his communication. I would show them videos online and say, you know, this is what intensive interaction looks like. Anyway, the long and short of it is, at the end of the 18 months, I finished working with him, and staff were saying that towards the end, they said, we can see a difference in him. So when you come in, it's almost like he stops doing that, and because he knew I was there for him. So when the 18 months were finished, I had a colleague go into the home to see the residents, and she said that she'd gone into his room, he was sitting in his room, and she, you know, was having a conversation with him, not expecting anything back from him, just a conversation like you would do, you know, like, oh, the weather's great, isn't it? You know, that kind of thing, and not expecting to hear anything back or have a response. So she said to him, oh, I think everyone's going out today. Are you going to go out with them? And he said, no.
Wow.
And she's got up and left the room because she couldn't believe that he spoke. And she called me, oh my gosh. She was so shocked. Yeah. And I was shocked because I hadn't heard him ever speak. Wow. And then he was taken, I think a week or so later, was taken on a van ride around the local area. And his mum lived quite near to where he lived. And they'd always go past her house, you know, on their journey. And this one day they took him past the house, and he said, Mum.
Wow. From being non-verbal to now being communicating, that is impressive. Yeah. And I thought, yeah, I'm doing the right job. Yeah, right. Yeah, there's a lot of satisfaction. I can see that. That's amazing.
Yeah, absolutely.
Wow, okay, alright.
There's many more stories. I know. Who don't have time?
Well, that was the standout one. No, that that's beautiful. And is there any kind of like misconceptions to the role of a speech and language therapist?
Absolutely. Yeah. I mean, like I said, people think that we do elocution. You know, it's that thing of, oh, can you can you teach me to speak like a posh English person? Well, no, that's not really what. And actually, a few people have said to me, your job shouldn't be, you probably shouldn't be speech and language therapist,
Right.
it should be communication specialist.
Right.
Because then people would probably
understand.
they'd get it.
Yeah.
Although that's not all we do, but you know, it probably goes some way to helping people understand. But yeah, there's quite a few that is one of the misconceptions anyway, and I've had, you know, people thinking that because we make a lot of resources, lots of visuals for people, and we use visuals to support everything really, because it helps with people, you know, whatever the difficulty is, to understand what's going on. So we use a lot of visuals, and I've had people say to me, that's, you know, we're just, oh, your job's easy, you could, all you do is make visuals all day. You sit on Google and, well, not really. So there is that. And it's a shame, because I was actually saying to a friend of mine yesterday, actually, we were talking about this, and you know, I said, I don't know that there would be many people you could stop in the street, and if you asked them what a speech therapist did, they'd know. I don't think there's that many, unless they have personal experience of us themselves. You know, there's not that many people that know.
No, yeah. And you make I guess a great deal to people that really need your services, especially when they're having difficulties to communicate.
Yeah, absolutely.
It's a fantastic job, because everyone needs to, you know, express themselves by any way means necessary. So
yeah,
really
absolutely. And also the swallowing, because the swallowing, I think, with the swallowing assessment, you know, and the difficulties that people have, even that is not well known. Not just for the fact that we do the assessments, but for the fact that the you know, dysphagia as a condition is not widely recognised, and people don't understand anything about it really. Again, unless you've had personal experience of it and you can talk about it from that angle, but not many people know. So, but yeah, that's a really important thing, because we are essentially the first port of call in that instance. If somebody has dysphagia and they are in the hospital, for example, they call the speech therapist before the consultant, because we know more about it than they do. You know, nobody touched them until the speech therapist gets here, because they, you know, we know what we're looking for. So yeah.
No, that's impressive. I can see the benefits completely. All right, so what we're going to do now is we're going to go into another part. It's called rapid fire, but it's just questions. All right, so I'm just going to ask you 3 questions. Let's pick a choice.
Yep.
Or yes or no. All right, so for our first question, who do you think is more challenging to work with? Someone that suffered from a stroke, or someone that is classified to be autistic?
I'd say probably the autistic person. Well, it depends. That's a difficult one to answer. That's difficult, because with the stroke patient, it depends on the type of stroke, and then the difficulties that result from that. Because you know, if you've been typically functioning for your entire life, and then you have a stroke, it's really debilitating, and that can be really challenging for people. So working around those difficulties and trying to support the person to be, you know, rebuild their self-esteem, as well as support them with their speech and language and any swallowing difficulties that they may have. That's a real challenge. But with the person with autism, there's a lot wrapped up in the diagnosis of autism. So there's, as well as the speech and language difficulties, the expressive and receptive, You've also got sensory needs as well. You've got behavioural difficulties because of their, you know, frustrations and difficulties with communication. So there's a lot going on there, and obviously I've worked with both. So I would say, yeah, I'd say probably the autistic person.
Okay.
Yeah.
Okay.
Yeah, I think so. Yeah, I think they're both challenging, but yeah.
Okay. Right, so for our second question, does delay in babies starting solids, does it have a correlation with delay in speech?
There isn't. I mean, with children and their eating and drinking needs, I mean, obviously there's a neurological difficulty there that needs to be supported. But in my experience, there's not really a huge correlation. I've not seen the two. Yeah, no. I mean, they could well be an outlier, but yeah, no. I mean, the two things, delay in speech with children, also can be neurological, but it can also be to do with the oral difficulties, and you know, there are other things as well, hearing needs. So there are lots of factors there in terms of delayed speech. However, yeah, the correlation between that and swallowing, I would say no.
Okay.
Only because there are more factors around somebody's speech, a child's speech delay, than there are around the swallowing difficulties. Okay. And I think it just depends on the type of difficulty that they're having, as to whether they would overlap, if you like.
Okay.
So yeah, so no.
For our third and final question, which activity, in your opinion, which activity would you recommend for someone improving their speech? Jaw exercises or singing?
I'd say jaw exercises.
Ah.
Yeah.
All right, cool. Fair enough. Okay, so for kind of to round things up in our last final questions, so what do you think healthcare, or how do you think healthcare will be without speech and language therapists?
I think the NHS, or you know, the healthcare in this country would struggle. I think as health professionals, we all have our role, we all have our place, and without speech and language therapy, there'd be a huge gap. I think at the moment, as I was saying earlier, the government don't appreciate us or value our skills enough. But I think there'd be a huge gap. Who would do the swallowing assessments in the hospitals? Who would do the communication assessments? And it's a very specialist area of work, and without us, I think they'd struggle.
Yeah, no, that makes sense. Do you feel that you see a profession change in any way? Like, for example, there could be so many different things, like the use of more technology, or you know.
Do you mean, do I see it changing in the future?
Yes, or have you seen it change?
Have I seen it change?
Have you seen it change, and do you see it progressing or changing in the future as well?
I think in terms of it changing, and from what I've seen since I've become a therapist, I think there's more emphasis on supporting people using technology which wasn't so wasn't really available before. We as speech therapists have become much more savvy as far as, you know, learning about communication apps and supporting people using devices, doing more with people who are really physically disabled. So that I've seen change a lot over the years, and I've even had to you know, educate myself more on what there is out there available, because there is a lot more available. In terms of future and what I can see changing, I'm not sure if much will change or much more will change until there's more recognition for us as a profession. And I think it really starts from educating young people in schools, you know, when they're going for their career choices and not having the option of studying to be a speech therapist. I've been in many jobs where we've had students come for placements, or people come for, you know, they're doing their A-levels and kind of trying to make choices for university. And I've always asked, where I've seen the occupational therapist student come along, I've asked, you know, what made you decide to choose occupational therapy? And they said, well, because our careers advisor said we should. Was thinking about doing something along those lines. So we chose that. And I said, did you hear anything about speech therapy? And no. And it's been quite a few students that I've spoken to that have said the same thing. So I think if there was more information out there about us and we embed it into our young people, and just generally, really, I think there'd be more changes, or there'd be more likely to be changes, I think.
And you kind of touched on that before, which was kind of what's missing in a sense, because that was going to be another kind of question. What else is so I know that's missing. What else do you feel that's missing from your profession?
Diversity.
Oh, okay, okay.
I mean, the speech and language profession has been going now for 76 years, something like that. And it was only really since the Black Lives Matter that things have really started to change. You know, there are a few people of colour that do, you know, qualify and come through, but it's still seen as a very white middle class profession. And the Royal College they've done a good job in promoting the people of colour in their, you know, in their profession, and it's been really positive, but there's still not enough of us. Yeah.
Okay. Yeah. It is.
Yeah, it needs to change. You know, whether it will, I don't know, but yeah, but it should.
Okay, so where can people find you or find services to facilitate their need to communicate? Do you have like a business or?
I do. I have a limited company which is called Open Says Me Limited, and I do have a website. So www.opensaysme.org, and so I can be contacted there for communication and swallowing needs if anybody has those.
Well, it's been fantastic having you on the show. I've learned so much, especially about the air part. So I've learned a lot, and it's been absolutely a pleasure having you on the show.
Thank you for having me, Ryan. It's been lovely to meet you.
Same. And thank you all for joining.